Congratulations for having your successful cataract surgery at Vijaya Nethralaya Super Speciality Eye Hospital. A lot of people ask us, Doctor, how do we take care of our eyes after cataract surgery? So I hope with this video we are able to solve all your doubts. Point number 1. There is very high risk of infection following cataract surgery. The eyes after surgery can get infected, and this infection can be very serious. One can experience sudden amounts of redness or pain after surgery. During this time you have to consult your eye doctor. But there are several things one has to do in order to prevent the risk of these infections. First thing, use of antibiotic eye drops. We would have prescribed 3 types of drops for you. One would be an antibiotic eye drop, second would be a non-steroidal anti-inflammatory eye drop, and third would be a steroid eye drops are given to prevent any sort of inflammation inside the eye. So it is essential, all 3 types of drops. If you are having dry eyes, your doctor would have prescribed another artificial tears along with these 3 basic eye drops. One thing, it is very important that you maintain certain time between the first drop and second drop. Minimum time is 5 minutes between drops. How to use drops, you can always find the link in the description below. So there is another video which says how to use eye drops. You can use that link, you can watch that video, and you can get to know how to wear drops. Now, in order to prevent infection, you have to use all the medicines that we have provided. All the medicines should reach your eye in both quality and quantity. There are things you have to do in order to prevent infection. One cannot touch your eyes or rub your eyes. You can sleep, ideally one can sleep in the opposite side of the surgery, or it's better to sleep straight. It's better to avoid the eyes coming in contact with any other surface which could be infected, which can probably increase the risk of infection. Additionally, you should not allow a single drop of water to enter your eyes. So, and in order to prevent splash injuries when you're washing hands and things like that, you're required to wear protective glasses all the time, especially when you're dealing with water. So you will have to wear these protective glasses whenever you're dealing with water, whenever you're washing your hands or brushing your teeth. You will have to wear these protective glasses. Now, in order to clean your face, you can use the provided sterile wipes along with your kit. You can use these sterile wipes to clean your face. Usually there will be secretions around the eye. You can clean those secretions. You can wipe your eyes. Then you can go ahead, open that sterile wipe, and you can clean your face with that. Wearing protective glasses, dark protective glasses, which you will have to wear for 1 month following surgery. Why these dark glasses is because your eyes, the retina inside the eyes, will be very sensitive to light. So for this reason, we ask you to stay indoors as much as possible and go outdoors only when needed. You should actually avoid going in the sun because your eyes are very sensitive to bright light. For this reason, we have given you dark goggles. We would want your eyes to get sensitized to the light, and slowly, maybe after a month or so, you can remove these dark glasses. You can live normally. If you have to go outdoors, we recommend you wear caps or hats in order to prevent direct light from entering your eyes, and as much as possible avoid areas with very high reflectivity. Areas such as snow, such as water bodies, lakes, all these places will have very high ultraviolet and light reflectivity, and this may cause some sort of inflammation and pain in your eyes. Some people say that they cannot wear these dark protective glasses during the night and in low light conditions. So do not worry if you are not able to see at night or in low light conditions. You can always switch from wearing dark glasses to, you can also switch to transparent protective glasses. You can use these glasses after sunset or in low light conditions, and during the day you can switch back to wearing dark protective glasses. Coming to food restrictions after cataract surgery. So ideally speaking, there are no food restrictions. If you are a healthy individual, you can eat whatever you want, but there are certain foods which can cause the risk of inflammation. There are some foods which increase the risk of inflammation. There are foods like alcohol which actually interferes with healing and can cause inflammation. So we request you to avoid alcohol and using other fried processed foods after surgery for up to a period, let's say 1 month after surgery. If you suffer from diabetes, you have to monitor your sugar levels from time to time. You shouldn't allow your sugar levels to increase. It shouldn't become very high, otherwise we are increasing the risk of eye infections. And also consult your physician if these levels are not controlled. If you are having hypertension, you have to monitor your salt intake and do consult your dietitian. People often ask after cataract surgery, doctor, I'm feeling very bored, what do I do now? Can I watch my mobile phone? Can I watch the computer? Can I watch TV for some time? So the answer is yes, you can see your gadgets, you can watch television, but I would say limit your usage. Use your mobile phones only to see who's calling or to check important messages if you have to. You should avoid excessive usage of gadgets, especially during the first 1 week and 1 month following cataract surgery. I would also say stop using these mobile phones or televisions or even LED lights 2 hours before going to sleep. Sleep is very important for the healing process. The quality of sleep actually decreases if we start using gadgets just before our sleep time. One can use warm LED lights, but one shouldn't use cold white LED lights. So, activities to avoid after cataract surgery. So, firstly, I would say you cannot fly immediately after cataract surgery. One cannot undergo surgery and then fly to another city. So yes, maybe during cataract surgery some small micro bubbles might be left inside your eye, and it takes time for these bubbles to disappear over time. So at least for 1 week one shouldn't be flying after cataract surgery. People often ask, can I drive after cataract surgery? I would say do not drive on the day of surgery. So maybe on the next day, if you feel recovered, you can probably drive. Avoid driving at least for 1 week following cataract surgery. Number 3, avoid lifting heavy objects. So when you try to lift very heavy objects, you will be increasing the pressure inside your eyes, and it is not good for your healing eyes. So avoid lifting heavy objects following cataract surgery. Avoid shouting and stress. So it is very important because stress is not good for the healing process. So I would say do not get your blood pressures up. Avoid using makeup and other cosmetics around the eyes following cataract surgery. I would say avoid using makeup and other cosmetics for at least 1 month following cataract surgery. Do not apply hair oil for at least 1 month following cataract surgery. People often ask, can I cook following cataract surgery? I would say yes, one can cook the very next day. I would say on the day of surgery, avoid cooking. On the next day, you can start cooking from the very next day itself. Then I would say avoid going to public places because there can be a lot of crowd, there can be a lot of handshakes. You're at the risk of having an infection and you do not want your hands or anything else to get contaminated, which can later come and infect your eyes because your eyes are at risk. So I would say avoid going to public places immediately for at least 1 week following cataract surgery. So when can you have bath after cataract surgery? You can have head bath After 1 week following cataract surgery, one can have head bath, one can splash water over the face, but please avoid putting water inside your eyes. Eye has its own protective mechanism. The tears are always being formed to remove all the dust and dust particles. One can wash and splash the water over the face. Okay, one should be able to do this after 1 week following cataract surgery. So follow up after cataract surgery. Your routine follow up is very important, and you are required to come 4 times following cataract surgery. So you are required to come on the 3rd day after cataract surgery, where we check if the eye is healing properly, if there's are there any signs of inflammation, any other medications that you require for your eyes to heal properly. And on the 10th day, you are required to come, where we check the pressure of your eyes. This is very important because in some patients, very rarely we do see some patients where their intraocular pressure, the eye pressure increases due to some medications, and we may have to do or alter these medications. You are required to come 1 month following surgery, and you are required to come 3 months following cataract surgery. This is your follow-up schedule. Please do not miss coming on the following dates. So I would wish you a very safe and healthy recovery. If you are having any emergencies or if you are having any doubts, you are free to contact these numbers. We will be there to help you out. Please do like and share and subscribe to our channel. Thank you for watching.